young physician made a simple yet groundbreaking discovery that would forever change the course of medicine, save the lives of countless women, and ruin his own. Dr. Ignaz Semmelweis was born in Hungary in 1818. He grew up in a modest family but displayed an early aptitude for academics. After school, he pursued a medical education. The young doctor began his career working in the maternity clinic at Vienna General Hospital. This is when he noticed a distressing pattern. Women who gave birth in the clinic where doctors were in charge had an extremely high mortality rate due to childbed fever. New mothers in the wards managed by midwives were just fine. This puzzled Semmelweis, who was deeply worried about the women and their babies, and so he became determined to uncover the root cause of the tragedy. Scientific study and meticulous research eventually led him to a groundbreaking discovery. He noted that some doctors transitioned directly from performing autopsies to delivering babies and hypothesized that they were transmitting dangerous pathogens that infected the new mothers. To address this issue, Semmelweis introduced a simple yet revolutionary medical practice: hand-washing with a chlorine solution before doctors attended to women in labor. This single measure led to a significant reduction in maternal mortality rates in the physician-attended clinic. Despite these impressive results, Semmelweis faced resistance from most of his colleagues. They simply didn't want to wash their hands. The medical establishment of his time was skeptical of his ideas, as the germ theory of disease was not yet widely accepted. The rejection and the tragedy that unfolded right in front of his eyes took a toll on Semmelweis's mental health. He started to experience depression and anxiety. In 1865, at the age of 47, he was committed to a psychiatric institution in Vienna. He died there just 2 weeks later, reportedly due to a severe infection, but most likely because he was badly beaten by the guards, though this was never proven. Semmelweis's story highlights the challenges faced by pioneers in medicine. His work would eventually become standard practice in healthcare, saving countless lives, but the tragic circumstances of his life and death underscore the difficulties faced by those who challenge established beliefs. Science advances one funeral at a time, the German physicist Max Planck said, or more precisely, a new scientific truth does not triumph by convincing its opponents and making them see the light, but rather because its opponents eventually die, and a new generation grows up that is familiar with it. What do you think about Semmelweis's story and its broader implications for innovation in science and medicine? And do we, as Planck said, really only advance one generation at a time? Please share your thoughts in the comments below.